So to start off, I just want to ask you if you have any friends or family members or friends of family members or vice versa. If you know someone who has cancer or has had cancer or anybody who has been in some sort of injury related accident like a car crash or just any kind of incident like that, I don't mean to make you emotional because of that question. I mean, kind of, sorta. I just want you to, I just said it to get you thinking about the kind of situation I'm going to talk about. Um, I hate to say it, but those situations are very common in today's world, and there's not much we can do about it. But there is one thing that could tremendously help, and that would be to donate blood. No matter what your blood type is, blood is always in high demand because of, the permanent factors today in our world. And I've actually given blood 3 times. One was at my high school blood donation thing, and then the other 2 times were at community blood centers. And I've been researching the high demand for blood now because all this coronavirus stuff is going on, and so it's in really high demand now. So I'll be discussing, first off I'll be discussing the main problem with the lack of blood donors. Second, I'll be exploring what causes the lack of blood donors and blood donation, and then thirdly we're going to kind of look at some solutions that might solve that problem. So, first off, I'm going to be discussing the main problem with the lack of blood donations. Donated blood is used for a wide range of circumstances. According to Orlando Health, it's used for chemotherapy patients who have cancer, premature babies, anemia patients, injuries suffered by any sort of accident. And then to kind of generalize all of it, to kind of put it in perspective, 1 in every 7 patients admitted to the hospital will need donated blood. Many harmful factors come from the lack of blood. According to American Red Cross, a blood shelf life is 5 to 42 days, so it's kind of in constant demand. If no blood is available for an in-need patient, probably the worst case scenario could be death or just worsening of their situation in general. According to Healthline, the American Red Cross aims to have a 5-day supply of blood at all times, and if that is not met, it could delay some serious procedures. So, now that we've kind of looked at the main problem of blood donation, let's kind of look at what causes the lack of blood. So first off, people are just afraid to donate blood in general. And a little story with that would be the first time I donated blood was at my high school, and my best friend was supposed to do it with me. We got all of our paperwork done, got through all the checkups and everything, and we were about to go, and she was just like, I can't do it. I'm not doing it. She was too scared to do it. And so I ended up doing it by myself, and then the second time we did it at a community blood center, and she ended up passing out. Not because of the giving blood, but because she freaked herself out so much, she just passed out. And so, it's kind of a funny story. But according to the University of Maryland Medical Center, 2 of the main causes are the afraid to give blood, and then also some people are just not eligible to give blood based on some of the medications they're taking, maybe recent vaccinations, a recent tattoo or piercing, or just diseases that they have in general can cause them not to be able to give blood. And then the third thing would be that people just don't care enough. Be that they don't know the person personally that they'd be giving the blood to, or they're just busy, don't have enough time throughout the week. They either work throughout the week, or like I said, they just don't have enough time in their day to get it done. So now that we've discussed the potential causes for lack of blood, let's move on to some solutions for the problem. So some solutions that can increase the amount of blood donors would be to make it more known, advertise for blood donation more. Um, let's say you're in high school or you're in college, make some flyers around campus or around your school to advertise for blood donation. Um, Maybe even television advertisements. I know that's something we can't help, but if you know anybody in that sort of business, maybe mention it to them like, hey, um, blood donation is at a low right now and we really need it. The second thing is make the incentive known for blood donation. It's not like a major one, but some cool things come out of donating blood. Think of it as you get like a little mini examination. It's like going to the doctor. You get your blood pressure checked, you get your iron count, your temperature, your pulse checked. You even get to know what type of blood you are, which I think is pretty cool. Um, and the last thing would be that blood centers are all over. They're local, they're close, probably like a 20-minute drive max from where everybody is, because I know there's some in Kansas City. I went to the one in Blue Springs. Um, and the amount of lives you save should be enough to get up and go donate blood, because your one donation can save 3 lives. And the fact that blood can't be manufactured means that it has to be donated for them to get. And again, the entire process probably lasts about 1 hour. I mean, it won't take up much of your day. And again, it's not very far to go donate blood. So, I have discussed why the lack of blood is a problem today, and I have examined what causes the lack of blood donors, and then lastly, I kind of discussed some of the solutions and actions we can take to increase the blood supply. So, as you think of those that are in possible need of blood, make sure you recall how you can benefit from it, and especially how they can benefit from it. You'll feel so good and accomplished knowing that your own blood has saved multiple people's lives. It's kind of a way to bring all of us together and care for one another. And if that's not a way to get you to donate blood, I don't know what is. But I think every person in the world right now can benefit from that.